autoimmune autonomic ganglionopathy is a rare disease that affects people all over the world. I'm guessing you have heard of diseases that affect your nervous system. I'm qualified to tell you about this disease because my mom has it and it affects my family and I's lives day to day. I have also done extensive research on this topic. Autoimmune autonomic ganglionopathy is, as I have said, very rare and more awareness needs to be brought to this disease. In this speech, I will be defining autoimmune autonomic ganglionopathy, explaining how it affects people, and communicating how we can bring more awareness to it. Autoimmune autonomic ganglionopathy is a form of dysautonomia. Dysautonomia refers to a group of medical conditions caused by problems with the autonomic nervous system, also known as the ANS, according to the National Institute of Neurological Disorders and Stroke. This part of the nervous system is in control of body functions like your heartbeat, blood pressure, breathing, and digestion. AAG, another name for autoimmune autonomic ganglionopathy, is a condition in which the body's immune system mistakenly attacks and damages certain parts of the autonomic nervous system. In AAG, your immune system damages a certain receptor in the autonomic ganglia throughout your body. These ganglia are groups of nerve cells in a body's autonomic nervous system. The groups of nerve cells send and pick up signals that control your reflexes and involuntary body functions. Involuntary functions are things you cannot control consciously. When a person has damaged receptors in the autonomic ganglia, their body doesn't process these signals correctly. This can cause a body's automatic body functions to not work properly. Doctors diagnose about 100 Americans each year with AAG, according to Cleveland Clinic. It is an extremely rare disease. It can impact people of all ages and both men and women equally. The onset of autoimmune autonomic ganglionopathy can be gradual or rapid. It is a very unpredictable disease. It comes with many hardships for the people who have it and their families. What causes this disease? Well, doctors actually do not really know what causes AAG. All they know is that about 3 in 5 people develop autoimmune autonomic ganglionopathy after having another infection or illness, according to Mayo Clinic. Some of the symptoms are dilated pupils, having a dry mouth and dry eyes, having low blood pressure, urinary retention, abdominal pain, vomiting, and fainting. AAG can be diagnosed by a gastrointestinal test, a gastric emptying, a tilt table test, a thermoregulatory sweat test, a urinalysis, and more. This disease can also be diagnosed by seeing if a person has high blood levels of antibodies to a protein called ganglionic nicotinic acetylcholine receptor. A gastric emptying test is a test that measures the time it takes for food to empty out of your stomach. A tilt table test is used to evaluate the cause of unexplained fainting, which is a symptom of AAG. This test requires a person to lie on a flat bed or table with a footrest and safety belts that is connected to an electrocardiogram, which is a device that records the electrical signal from the heart and blood pressure monitors. During a thermoregulatory sweat test, a person will lie on a bed and will be powdered with a substance that changes color from yellow to vivid purple as they sweat. The humidity and heat controls in the room help the person to sweat everywhere in their skin regions that are able to sweat. This test is used to evaluate the wholeness of central and peripheral sympathetic pseudomotor pathways from the CNS to the cutaneous sweat glands. Some treatments for this disease are a plasma exchange, IVIG therapy, and immunosuppressive medications. A plasma exchange is the process of drawing blood, removing the harmful chemicals from plasma, and returning blood to your body. IVIG therapy, which is also known as intravenous immunoglobulin, gives your body extra immunoglobulin in the form of an IV. Immunosuppressive medications like Rituxan reduces a person's immune system's effects on healthy body systems. There is no sure way to prevent this disease, but there are a few ways to reduce the risk of getting it, like aerobically exercising, having a high fluid, high salt diet, managing stress, and having a good sleep schedule. There is no cure for autoimmune autonomic ganglionopathy. The life expectancy for someone with this disease is 6 to 9 years. We can bring awareness to autoimmune autonomic ganglionopathy by talking about it more and looking into it so we can help people who have it. We need to educate more people about autonomic diseases in communities and in schools. If we do more research, we can maybe find a cure or make new discoveries. Just because this disease is rare does not mean that it is not important. To summarize, AAG affects people all over the world and is important, and we must bring more awareness to it. We need to be empathetic to the people who have this disease. Today, I defined autoimmune autonomic ganglionopathy. I talked about how it affects people, and I explained how we can bring awareness to it. So after hearing this speech, I hope you go and share this information with a friend.